So I'm here this morning with Dr. Keith Grimes, an NHS GP here in London, and I'm curious about your work so far with, you've been experimenting with virtual reality. In fact, in your doctor's bag, you have a VR headset, a mobile VR headset that you have used with patients. So can you tell us more about what triggered you to actually start exploration of this new technology here?
Yeah. Well, this is my doctor's bag, and as I will show you, this has not been set up. This is my Samsung Gear VR, which I use almost every day in my practice now. I've always been interested in technology, which is maybe why I'm one of the first people to do this. But what triggered me was listening to patients. As a GP, we're taught to listen to patients, and a patient came to me, in this case a rugby player, with painful wounds that needed dressing. He said that he needed some extra help in being distracted. I'd been very well distracted by my experience of using this, and I just brought the two together, and I've gone from there.
Excellent. So, Dr. Grimes, in terms of creativity within the healthcare system, when it comes to your formal training at medical school, your career to date, practicing as a GP, at what points have there been any formal ways of increasing awareness about what creativity can do within your field?
So I've been working as a doctor for 20 years now, and so some of the education may have changed. There were some nods to it in my medical school training, but the biggest impact that creativity had in my training was as a GP, where my GP trainer, when I was training in Edinburgh, took me for a full day to the Gallery of Modern Art in Edinburgh, and we spent a day learning about art criticism and appreciation. At the time before I went, I thought he was crazy. I came away afterwards, and I have used things that I've learned there in every day of my practice since. Since then, and recently, I went to Wired Health in London and heard about the work of performance artist Lucy McRae. She has been doing some extremely interesting work in the future of medicine, and through her art has actually brought people in healthcare and technology to her door to ask about how they can take her ideas into healthcare.
Wonderful. And so in terms of, you know, we hear a lot about the marriage of healthcare leaders like you and the technology sector working together to create new solutions for folks. But now, you know, we don't see that much in terms of the marriage of healthcare leaders, technology sector and the creative sector. And we see, you know, some of this new technology like the Oculus Rift, the VR headset. This has potential, and this has come from the computer games industry, but how would you envision at a very high level, how would you envision how the creative sector, with these new technologies such as VR or AR, how would they actually look to work with both technology folks and with healthcare leaders to actually start exploring what that union might look like and what solutions might come out?
There are two ways of approaching that. Broadly speaking, from the top down with those people that decide on and commission healthcare, and then from the bottom up, working with the people, the coalface, who are delivering the care, the nurses, the doctors, the physiotherapists and the like. I'd say I would use the same approach that was used on me, which is to get out there and help the decision makers experience virtual reality and augmented reality, experience what the creative process can do, and then let them realize how that might be able to solve some of the problems that they're experiencing in healthcare. And then from the bottom up, exactly the same approach. Speak to your doctor, speak to the nurses, take your experience and your passion for the creative process and share it with them, because at both ends there is a huge well of interest in being creative and solving this. It's just allowing them to use another avenue.
Excellent. And for the people watching at home, what would be your final takeaway message about the role of creativity to make healthcare sustainable in the 21st century? What would your final closing thoughts be?
To make healthcare sustainable in the 21st century, we're up against quite a lot of pressures in terms of demand and supply or resourcing. Creativity allows you to take those resources that people are more interested and entertained in engaging with and allow it to address those problems. So I'd say use that energy and resource which comes more easily in the creative process to deliver solutions in healthcare.
Excellent. So thanks for your time today, Dr. Grimes, and thanks everyone for watching.
Yeah.
Bye for now.
Goodbye.